Talking about sex doesn't have to feel awkward or weird. Today's conversation is about rewriting the rules of sex, pleasure, and intimacy, especially the ones that no longer serve us. My guest, Heather Edwards, brings a rare mix of pelvic health, sexuality counseling, creativity, and humor to topics many of us were never taught how to talk about, especially safely. This episode invites you to question narrow definitions of sex, release performance pressure, hello, and reconnect with pleasure as something expansive, human, and personal. Well, let's get started. Hi, everyone, and welcome back. I am here today with Heather Edwards, another amazing guest, and I've been waiting to talk to her for a while. So welcome, Heather.
Thank you. It's so good to be here. I'm excited for our conversation.
Me too. Me too. And already, I just want to tell y'all, you got to stick around to the end. There are so many questions, too many questions that I actually have for Heather. But before I get started, I just want to do my typical bragging in the beginning. So I'm going to tell you guys a little bit about Heather and what she's doing. It will definitely not encompass everything. So hang on. Here we go. Heather Edwards is a writer, sexuality counselor, and pelvic PT. As a pelvic physical therapist, she quickly learned that talking about sex in a way that creates safety and comfort is her superpower. I love that so much. After training at the University of Michigan for a dual certificate in sexuality counseling and education, which is no small achievement, she achieved national certification in both. She's the course and content director for Pelvic Global and teaches the Pelvic Health Sexuality Counseling certification with her amazing colleague, Dr. Uchenna Osai. Always a fan of out of the box educational styles, she's authored and illustrated 3 coloring books. I've got to see those that celebrate the diversity of genitals. Yes, an illustrated storybook about a non binary vulva breaking free of patriarchal norms. I've also have to see this. And an erotica novel, June Full Moon. It's like so much. It's on my Christmas list. For the past decade, she's been delivering community sex ed with the live show, Vino and Vulvas, and I am adoring that name, in Asheville, North Carolina. And there's not too many times that our like guests on the Vocal Pelvic Floor are also in the state. So and I'm in the mountains and she's in the mountains today. So we're actually not that far away from each other. We could have done this in person. But to round things out, she enjoys playing the cello. Oh, love the cello. Writing on her old school typewriter, kayaking, dancing, geeking out about nature, and powerlifting. Welcome, Heather.
Thank you so much.
All right. So let's first of all, right out of the gate, before we hit record, we were talking about just eliminating confusion. And there's so much stigma and confusion around talking about sex. So the first thing that I wanted to ask was the difference between sex therapists, sex counseling. Like, can you just clear that up for us? Because I want the listener to understand like where they need to be going to get help.
Absolutely. And it is a really unclear thing. And I think it's something that like blocks a lot of people. Not very many people know about pelvic physical therapy. And, when they find out about that, it's like, oh my gosh. And so like all of these other things kind of become a little more and more obscure. And often, someone with a vulva will like ask their gynecologist about like their sexual health, and there won't really be like a great answer because gynecologists don't actually get any training on sexual health, which, is kind
That's
of
a truth
crazy.
bomb.
Right.
Yeah.
And also, here's another one that blows my mind. Marriage and family therapists also don't get training in sexual health. And it's like
Oof.
right? Like, it's like sex is just so taboo that it's like all of the places that you think you would be able to ask for it, right? You go to your
Right.
couples counselor, you go to your gynecologist. There's no guarantee that they have any actual training in sexual health.
It's
Um,
amazing that the places that you would go to find that sanctuary and safe space to
right.
talk about it, and they're not even talking about it there.
Right. And so, you get brave enough to go out and actually like say the thing out loud, and then it's met with like crickets, or not knowing where to go. So I just want to talk a little bit about kind of where else like you can look and what some of the differences are. So there are medical providers that are trained more specifically, as I am, because I'm a pelvic physical therapist by trade. So I come into this with a medical background, right? So I am certified as a sexuality counselor. The way that our certifying board kind of separates between counselor and therapist is that therapists are mental health providers. So they have to be a licensed mental health practitioner. Okay. And then sex counselors are generally going to be medically licensed, but also they can be like clergy or people who have just had additional counseling training but aren't licensed mental health professionals. So that's just kind of a good thing to understand. The difference in the approaches is generally that therapists are going to be really good with the things where you need to like kind of dive into the past or like dive in a little deeper or uncover some of the things like, you know, the everything's going well, but I just every time, my partner touches me, I think about that thing that happens or like, and then I get triggered. Like that sort of stuff is really fantastic to take to a mental health professional to help you understand like what's going on with that. As far as sex counselors, and I'll also lump sex educators in with this as well, we're really good at breaking down. Like if someone comes to us with a problem, what we're going to do is help you kind of like break down what the pieces of that problem are and then offer education and step-by-step ways to kind of get to the other side of it. And then if we see that like that progress is being blocked by resentment or lack of trust or things like that, then that's when we would be like, hey, so I think mental health professional would actually be really helpful for this aspect of it. But we kind of function a lot more in like a coaching role, with like, here's our goals. We're going to break them down, educate you around them, and give you simple solutions and like specific solutions in order to move forward through this. So
Yeah.
that's kind of what there is
Thanks
there.
for that clarification. Because there's a lot of strengths in both, and at some point,
Mhm.
you're probably going to need both,
Yeah.
depending on what happens to you while you're on this lovely planet. The really cool thing about what you're doing is that if someone also has these biomechanical, biotensegrity, these other issues that are a physical impediment or impairment,
Mhm.
or they've undergone a procedure, a surgery, um, gender affirming, procedures, et cetera, like, and hormone issues, like that's a massive thing too.
Mhm.
It That can fall under one umbrella in addition to the counseling that you're able to provide, which is just, it's a brilliant thing. And I'm really glad that you're out there doing it.
Yeah, thank you. I love it. I really, really enjoy it.
Yeah. Okay. So I have this question first.
Okay.
Not really the first question, but it's at the top of my mind because when I read the title of your show, I was like, oh, I got to learn more about this. Tell me about Vino and Vulvas. How did you land in that space? I mean, where did that come from?
Oh my gosh. So I love this story. I mean, and I have like 12 different versions of the story because it has so many different legs. So I will try to be brief. Um, Basically, when I started the show in 2015, and I tended to gravitate toward other like sexual health professionals in town, or like those are the people I wanted to be friends with, right? Like, who are they? And so I found one sex therapist in town, one sex educator in town, one woman who did like pro domination work and was also a UU minister, and then someone who did like somatic body work, that was like somatic sexuality body work. And like those were like the only, like there were hardly any other pelvic PTs in town at that time. There were really not very many like sex therapists. Like it was, there were not many of us around. And every time I would get together with any of these friends, we would both like usually say like, oh my gosh, like I have like 5 friends who I wish could sit in on this conversation with us, because these are the things we're talking about, like that when you're talking with your buddies, like these are the things that keep coming up around marriage, around pelvic floor health, around, body things and orgasms and sex and all of that. And so we realized that we were kind of having these conversations that would probably be helpful to have for a wider audience. And so that's what we did. The name Vino and Vulvas, we started in a wine bar, and it was just like a and it was vulvas is not because it is exclusive to people with vulvas. It was more, it came out of a like, it's a vulva, not a vagina, right? Like that was the conversation in 2015.
Yeah.
So it gave me the ability to have like, my banker and my accountant and all these people have to say vulva, right? Because of the business. So it was sort of just a like, let's put this word into the conversation.
That's awesome.
Yeah, and so then the vibe was kind of like, we had like all these comfy couches, like let's sit around on these couches and drink a glass of wine or whatever you want to have, and we will plan some conversations, and whoever wants to show up to it can show up to it. So that's where it started. And then it grew, we outgrew that space. And then I think this next year we'll be in what I think is maybe like our sixth space. Um, yeah. And every year it changes a little bit. But basically what I do is they're all panel discussions, but I realize that panel discussion sounds wildly boring. So it's basically, I usually host, and then I have someone that comes from more of like a mental health background, and then someone who comes from more of a medical background, and then someone who comes from more of a like erotic performance sex educator, or like a sex worker, or someone who they don't have a licensure that they have to uphold to when they're on stage. I have one of my favorite panelists is a drag queen, and they come on
Oh my
stage
gosh.
and drag, and yeah, and that's
That's
just
awesome.
pure magic. But it's nice because then it makes everyone have to stretch outside of their professional window, right? And be able to have bigger conversations. I learned early on that like putting like three pelvic PTs on the stage was an awful idea, as was putting three therapists on a stage, or like anyone. It's like, no, no, no. We need to like mix up people so you all don't get the same language that you could speak about. So everyone else can understand what the heck you're talking about, and you can challenge each other and all of that.
Yeah.
So yeah, so we have just
I
like,
love
we
that.
try to cover all of the topics. I've got a really fun group here now that like kind of likes to be on the panels a lot, and so I'll kind of help source them, like what is it we need to talk about, what are the conversations we need to bring to the community this year, and yeah, and then we go from there and put it together, and they're always an absolute blast.
I gotta come at sometime.
You should come. You
I
totally
do.
should.
All right. After this, I have to figure out when they're gonna be. I am not that far away. I can make that happen. So I am sure this was one of your questions then. For as many, how many? 2015, you said, so a decade of doing this.
Yeah.
I don't think you could ever exhaust all the topics, but we're just going to throw some things out there.
Right.
So I think one of the most common things that people don't think about until maybe they're questioning their sexuality or how they
Mm-hmm.
identify is this idea of coming into a care scenario where they as a patient or person or client may consider, a human being may consider themselves to, they may be roping themselves into this narrow heteronormative default definition of
Yeah.
what counts as sex, right? And it
Yes.
makes me do air quotes and shrug my shoulders and get this look on my face of, oh, but I think we do that to ourselves. But then you can go into care scenarios where that is
Mhm.
also the default definition. And so how can we, as the listener, begin to understand how to reframe that conversation? Because obviously it limits our ability to talk honestly with the provider about what's happening, in our bodies.
Right. Yeah, and when you and this is when I'm teaching medical professionals how to kind of be better at talking about sex with their clients. One of the big things is like we need people to ask questions in a way that don't put the client and or patient in a situation to where they have to come out,
Mm,
right? Regardless of what that is. So if you ask a question, if you have, someone who looks like a cisgender woman sitting in your room, and your questions automatically go toward you and your husband, right? Then all of a
mhm.
sudden that patient has to sit there and like, okay, are they saying that because that's just the easy thing, but they would be open to anything else? Or are they saying that because that's going to be the only acceptable thing? And if I break that mold that they're expecting, then the level of care that I'm going to get is changed and I'm going to feel judged. So if they, I mean, even sometimes like if they don't have a husband, right? Or if they are gay, or if they have multiple partners, or, anything like that, like, so if questions are asked in a way that don't presume what a version of the answer, then that can be a lot easier. Now, from a client's perspective, like, so when you go in and you see your practitioner, and if they ask you a question like that, it takes a little bit of a bravery to kind of like challenge them on that. And, and it's tricky because you can put yourself in a situation to where maybe you don't feel quite as safe, or you feel judged, or you're putting yourself in a place where now all of a sudden your practitioner does not feel as competent with your care, right? Like if you are
Mhm.
someone who they were presuming to be straight and now you tell them you're gay, and all of a sudden they're like, oh, I don't know what to do with that. That can be a place that kind of puts someone on a defensive. So it is tricky. But that's definitely something that you can kind of get ahead at the beginning. If there's like a questionnaire or something that you feel, safe in answering questions about, that they can have going into it, to where they know a little bit more about you, great, that can be helpful. Also, if you can call ahead and kind of get an idea of who you're going to be working with, or look on their website and see like if they have anything that flags them as safe for the thing that you are concerned about. This is the same thing with kinky folks, right? Like, so people who just don't do sex in the ways that are like the prescriptive, this is how it all sort of works, like all of that can fall in the realm of, I might freak out my doctor if I say this out loud, right?
Mhm.
So finding doctors, and a lot of times in these communities, there are ways that they're communicating with each other, to where if they have a good experience with one practitioner, they will be like, hey, this person's great, go see them. And so like asking within your community for who has had good experiences with good providers in the area is probably one of the safer ways to go, so that you don't have to be faced with that situation of having to come out and risk being judged, because like that is not your job to
Mhm.
educate your provider. And you certainly don't want to have to make your provider feel uncomfortable. Not that you don't need to make your provider like feel comfortable, but you also, sometimes it's like, I don't want to get them on the defensive, or just feel that complicated energy in the room. So find someone who you can be your whole self with as easily as you can, so that you can walk in and say what you need to say and ask all the questions and get the information that you actually want.
Yeah. So I think that, to dive a little bit deeper on that, like
Mm-hmm.
for people who have defined sex as like penis, vagina, that's it,
Mm-hmm.
um, they're also going to define sex, by maybe like only, like orgasm only, right?
Right.
So they've got this narrow, coming in with that heteronormative default definition. How do, as a provider, look, let's go at it from the client perspective. Let's go at it
Okay.
from the listener, right? They're going to go in and they don't even know that they have this normative, heteronormative definition default, and they're going for help. So they're going for help already, but they're kind of locking themselves into this one definition of success.
Yeah.
And I think that's probably a common myth you see repeatedly, is people that keeps people suffering like a lot longer than they think, because they thought, well, this is failing. This is not working, that kind of thing. How do then, how does a listener challenge themselves to that definition and get outside of that?
Yeah. So I think the best question, like you hear this in sex therapy too, and then also in sex counseling, right? Sex usually isn't actually the problem, right? I mean, yes, sex can like not be working great, but like often the reason that people will come into to seek help for it, it's not necessarily because like sex isn't working. It's because sex isn't working, and now my relationship is at risk. Sex
Mm-hmm.
isn't working, and now I don't like, I'm afraid my partner is going to cheat on me. Sex isn't working. And so there's usually like a relational, or like sex isn't working. Like I've always been able to have orgasms really easily, and now I can't. And like I feel like I'm losing my sense of self. Right. So there's usually like it's a deeper thing than just like the physical act of a thing working. And like we see this like it shows up. So, you get someone who comes in and has like say, like a pain with with penetrative sex. Okay. And it's like, okay. And so for them in their head, they might have this idea of, when I get this fixed, everything with my relationship will be fixed, because the problem with my relationship is that sex isn't working and it's my fault because it hurts. Okay. So then
Mhm.
all of a sudden we get them to the point medically where sex doesn't hurt anymore, but they're not pleased. And it's because they're still having all of the same relationship issues, because those haven't actually been addressed or talked about. Right. So, so as far as for clients, like I would really recommend like think about, like go beyond, like sex isn't working, and so that creates, what are the problems that it actually creates? So often when I would ask people in clinic, so like what is it that you want? Like what's missing from your life with sex not working for you? You know, and often it takes a little bit of prompting for them to kind of like understand what it is, but usually it comes down to like connection and love. And this is how me and my partner, this is our intimacy, this is
Mhm.
the thing, and now like that's missing. So when we kind of start to look at that and then realize that we're tying like love and connection and intimacy to an act of a penis having to be erect and a vagina having to be supple and comfortable, it all seems a little silly, right? So and that goes both ways, right? Like
Mhm.
so the act of questioning that and separating out like love and intimacy and connection and like exploration and adventure and like whatever it is that sex is for you, please do not limit me to, don't limit it
Yeah.
to just these words that I'm saying. But when
Mhm.
you tie those to a physical ability to perform, I mean, no one can keep performing their whole life. So then the question is just like, are you ready to let go of all of those things that you want as soon as one of you has an issue to where your genitals aren't functioning,
Yeah.
you know?
Yeah. So, in talking about like the silence around sexual health, what you're really
Mhm.
describing is like rewriting sexual scripts, like
Yeah.
moving beyond these old, tired, worn out, busted dance moves, old defaults, to borrow
Right.
words from an animated film. I
Mhm.
can't remember which one it is right now, maybe Megamind or something like that. But that work is like deeply liberating for people, the work that you're doing, the work that you're encouraging them, and being that guide, um, for them, reminding people that, yep, sex is more than penetration, more than orgasm, more than performance.
Mhm.
I think that word probably gets a lot of people into, like angsty troubles, like that idea of performance. So how do these kind of rigid sexual scripts, meaning, you know, what I mentioned before, penis and vagina is real sex and orgasm is
Mhm.
success or whatever. Obviously, these are harmful, right, to people's pelvic health and sexual health.
Mhm.
So, how are the ways that you see those rigid sexual scripts that we need to burn? How is that harmful? How do you help patients explore pleasure outside that narrow framework that maybe came with social, cultural conditioning, whatever they picked up
Mhm.
along the way?
Yeah. So one of the things that you said, how do you help them explore pleasure? One is like get them to understand that pleasure actually exists and matters, right? Because it doesn't for everyone. Like part of the sexual scripts, and when we say sexual scripts, like if you are listening to that and you're like, I don't know what they're talking about, like take a piece of paper and write down sex is, or sex is for, and then
Love that.
finish the sentence, right? I have
Yeah.
a handout with this that has check boxes for it. And like, so I give like, 30 different options of what sex is for. People usually read through that and are just like, oh my gosh, like I never even considered it. but it's really good to get an idea. Like first you have to see the script, right? You
Yeah.
have to see what it is, because often sex is for appeasing my partner so they'll stop being such a grump.
Mm.
Sex is
Ouch.
for right. Sex is for making sure my partner knows that I love them, because that's the only way I know how to
Mm.
convey that, right?
Yeah.
They're like, so those can be some of the things, and those are really important to understand. And so for people who are coming to the place of like, well, I don't really like it's very hard to have sex, or to want to have sex that you don't actually want, right? Like that you don't enjoy. So if
Mhm.
you're not getting something out of your sexual health, or out of your sexual experiences and your sexual connection, because you're just doing it as a, I need to cross this off my chore list, right? Like it's really hard to want that. It's hard to want
Yeah.
that other chore. And so often some of like the problem comes from that lack of actually feeling connected, over that, like everyone wants to feel wanted and seen and desired,
Mhm.
right? Like
Yeah.
and so when sex falls outside of those things, and we're just doing it as an act, we're just doing it like, oh, we got a vacuum today, oh, it's Wednesday, it's the day we have sex, or whatever, that like there's just so much that can be lost in that, in the way that we connect, and in like the deep way that we experience ourselves as a human, and we lose that ability to actually see each other for who we are and for what we want, and and not being able to tie pleasure into it. Like when it's a chore, like you're not going to usually vacuum for pleasure, right? You're not
I
like,
don't.
I know. Me either. um but like, so the idea that pleasure is even something that everyone is entitled to is news sometimes, right?
Yes. Mhm.
So, because if you are coming from a culture where your script is that, what is one of them? It's the oh my gosh, I can't even think, but it ends in and a and then like a tiger in the sheets, like a lady in the streets and a tiger in the sheets, or something like
Oh,
that, right?
yeah.
Where it's like there's this expectation of how you should behave on the outside, and how you should behave, and like it's your job to kind of like really make sex really good for your partner and things like
Mhm.
that. So so being able to kind of like break those things down and understand where they're coming from, and then it's like, do I actually enjoy that? Like what actually brings me pleasure? Because when we're only doing sexual acts to serve someone else, or to bring someone else pleasure, we're not asking ourselves
What we
what we
want.
want. And here's
Yeah.
the kicker with this, right? Like, so when I talk to, if we're talking about straight couples here, right? Generally, this dynamic is going to be such that a woman in a straight partnership is going to feel like they need to be the one to provide and, you know, give their husband sex, right? Like that is one of
Mhm.
kind of the more like the scripts, the norms
Cultural
we
kind of
kind of
tropes.
have,
Yeah.
right?
Yeah.
But often, like if you talk to the men in those situations, like what they want is to feel like they're good at sex. Like they want to feel like they're actually like making their wives like enjoy it, and like actually like having an orgasm, and and then it can become like, pressure on their performance for it. But like generally they're also seeking connection. They're also seeking this like shared experience, and like they would love to know, like what is it that you want? Like what are your fantasies? What are the things that you think you would enjoy? What are some of the adventures we can have together?
What
And
yeah.
for women
Yeah.
who are taught that like they're just supposed to provide this service, it's really hard to be like, oh wait, what? I'm supposed to like it's very scary to ask the question, to answer the question of like, what actually do
Yeah.
I want?
I
You
think
know?
that's a question that, um, in general, women overarchingly aren't even taught to ask or explore, like,
Mm-hmm.
regardless of how they identify, sexually.
Yeah.
They're not taught to do that, and that is definitely changing. It's why I wanted to do this, entire season just based on sex alone. And that kind of takes me full circle back to what you mentioned with your sex is like worksheet checklist
Mhm.
thing. Okay, so I gotta learn. I gotta know more about that. So first of all, what are the boxes that can be checked? And are we talking
Mm.
about things like you people like initiation styles? Like I like an emotional
No,
initiation or physical, or is this like the touch that people like or how they define it or intimacy is or types of stimulation or types of play or
it
what's
is
on that
not
list?
even yeah, hang on, let me find it. Let me
Okay.
find it for you.
Yeah.
Yeah, the idea is more like, it's more like what do you get out of it? Like what is the result that
Okay.
you want from
Okay.
sex, right? I
Hmm.
mean, all of those things that you mentioned all also super important, but that's not what this particular one, because this one is more about um getting
What you pull from it, what it
yeah,
provides you versus maybe the what you like inside of,
yeah.
sex
So
itself.
you want me to read the list to you?
Sure. Yeah. I'm sure the
Okay.
listener would love to hear
Yes.
it. Me too.
So, everyone, you can get your, hit pause and then get your notebook ready, right? So, what is sex for? Sexual pleasure and orgasms, quick intimate moment in a busy life, relaxation, to help sleep, pain management,
Mm.
to feel desired, connection, intimacy, to be present, to escape, to adventure, to serve and care for another, to feel more in your body as service for an exchange, to feel open and vulnerable, to do a fun thing together, to appease, and to de escalate a situation.
Wow.
Yeah. So, it's funny. I thought I had on here like a reward for chores too, but I think that was in the more for my masturbation list. It's like,
Oh, gosh, we've got multiple lists to get
I
to.
know.
Oh my
But yeah,
gosh. So do you have then so I want to go a little bit into anatomy, but in order to do that, I think we have to ask one more question because this goes back to the cultural and social conditioning, kind of like women, really all people. I think everyone probably has a hard time like discussing what they want and need because they've never even been allowed to really explore or ask that question. So do you have, I'm sure you do you have another checklist that talks about like all of the types of things that they like how do they explore pleasure outside that narrow framework of what we came in with, um like
yeah, like kind of like a how to explore sort of thing.
yeah, it is kind of like a how to because if they've not really been allowed even in their own mind given themselves permission to explore what kind and it's not necessarily well, I mean a lot of it is based in touch, but some of it is more emotional or energetic as well. So,
Mhm.
um can we talk a little bit about that before because that's going to like segue us into like
Yeah.
understanding the body, like what's going on.
Yeah. So I don't have a simple handout for that because it's kind of lots of different layers of things.
Mm.
Um, two of those layers that I want to talk about that are like often kind of my go-to um my go-to with this. One is understanding power dynamics with sexuality. And really power dynamics with all of life, but this idea of like trying to figure out with like what your sexual appetite actually is for. So to engage in a sexual experience, then it can be really important to understand like what is your actual energy going into this? And what that means is like if you are like if someone says like, "Hey, do you want to have sex tonight?" Like
What does that
what does
mean?
that mean? Right. And one of the things that like you kind of have to check is like, are you in the mood to be someone who is, or like to kind of like be more of a leader? Or are you like, yeah, I would love for you to take the lead and I will follow along. Right. Because that is kind of an agreement that needs to be established a little bit. right? And
Mhm.
also it's good to sort of be able to name it so that if you're realizing you're like, yeah, I would be game to have sex, but like my brain is exhausted. I'm not going to have all sorts of like fun, creative ideas. But if you do, I am happy to go along with whatever you want, right?
Yeah. Yeah.
So being able to just kind of get where you are with that. And then like, and so in that case too, like if it, say it's like date night and you're coming into it and like date night is the night you have sex because you got the babysitter, you know, all of the things, right? But then like you go toward the sexy version of it and you realize that neither of you are actually in the mood to like be creative and make the thing happen, and like your just bodies are tired, so like having to do something over and over for a long period of time when it's like, but my like hip and my back is doing this thing or something, like those are good things to understand. And like you, so then if you do can try to just go into it and have sex, right, then like you're probably not going to have a very good experience because no one's like wanting to step up and do the thing, right?
Yeah. Yeah.
So you can, you know, so with kind of options like that, like you can be in cahoots and realize neither of us are actually in the mood to do this thing. Isn't that funny? It's our sex night. And instead of doing that, what we're going to do is eat popcorn and watch this movie we've been dying to watch. And it's going to count as sex
Yeah.
because we approached it from this
That's
sexual,
what you got.
that's what we're in the mood for, right? On our sexual
Yeah.
appetite, that's what we're in the mood for. The other
Yeah.
option that I always recommend for long-term partners is to have the laziest version of sex possible that you know will just work, right? Like
Yeah.
usually it's going to involve like a favorite toy or something that like helps get things there faster. No one has to move a whole lot. It's a position that's real comfortable for everyone. You know, you can
Yeah.
also be in cahoots about like, oh my God, we're both exhausted, but look at us making this thing happen, you know.
I love
And
that approach.
right. So then it's also
Yeah.
this really fun, sweet, connecty approach to have really like boring, quickie sex, but like by God, you got it done,
You got
right?
it. That's
And
right.
then it's like, and then you win. Okay.
That's a
So
win.
it's totally a
It's
win,
a win.
right?
Yeah.
And
Mhm.
so it can turn it from like, you know, if from your expectation to realizing that you just did some varsity level communication to understand what it
Yeah.
was you actually wanted out of sexuality and there out of your sexual experience, and then you got it, right?
Yeah.
So
It's like taking that what would have been an expectation, which is always so heavy and
mhm,
it doesn't go to a good place, to just anticipation of this is what we've got, so let's see what we can, make
yeah.
happen. Yeah.
Right. So that's like the foundational underlying piece that is really, really important for us to engage in the kind of sex that we want, right? Like we have to
Mhm.
understand on an energetic level, what do we want? Okay.
Yeah.
Because so often we just think that there's like two roles, which is like the top role and the bottom role or
Mhm.
whatever it is, you know. In
Mhm.
hetero, it's usually just the thing that the man does and the thing that the woman does, right? But like there's a lot of variation in that. And like if you
Mhm.
can also look at it as like the person who might be following might be the one that is doing the thing, right? And so what that looks like is a like, tell me what you want and I'll do it to you, right? That's the boys to men, I'll make love to you song. It's that whole role, right? It's not a I want to do this thing to you and so, you know, and like it is the you tell me what you want and I will do it,
Yeah.
right? So then that other role is the being able to say like I'm going to tell you what I want you to do to me. That is
Mhm.
also a really good match, right? Those two people.
Yeah. Oh.
But if you don't have someone who like wants to do the thing in that
Mhm.
pairing, then you have to kind of like readjust. Either someone's
Or
got to
they
like step up or you got to just be like,
right.
all
Somebody
right,
does gotta know what they want and know how to do it on the other side. That's a lot of
right,
expectation, and it can totally drain the anticipation out of all of it.
right. So opt
Yeah.
for boring sex or not sex instead of bad sex, right?
Mhm.
Yeah.
That's a good one.
And then you're much more likely to have really good sex when you're both in the right mood and you can name what those dynamics or like name what you want
Yeah.
out of
Oh,
that.
that's
So
perfect segue into what I was gonna talk about next,
cool.
which is understanding the body.
Mhm.
The basic stuff, like, we know that sexual success does not have to equal orgasm. So let's just get that out there and out of the way
Right.
right now. But I think at a baseline too, when people are curious about, like, how do I even get there? How do I get my partner there? Or if we started with those basics of, because if I back up one step and say, okay, if a patient doesn't know the difference between like types of orgasm and how they get there in the anatomy, how are they going to move beyond that towards other things, the different types of touch, different types of intimacy, if they don't know the basics, of
Yeah.
anatomy?
This episode is sponsored by Intimate Rose, the world's most trusted pelvic health brand. And yeah, we're talking pelvic floors on this podcast. Look, we all have one. Some of our pelvic floors behave and some of ours rebel. Mine? Well, mine staged a full-on mutiny years ago. Pelvic pain, tension, the whole dramatic saga. Let me tell you, nothing humbles you faster than realizing one very small group of muscles can absolutely run your life. That experience is exactly why I love Intimate Rose. Their tools, pelvic wands, dilators, vaginal weights, postpartum recovery products, all designed by a pelvic floor specialist, are gentle, high quality, and clinically trusted all over the world. And unlike the mystery gadgets you can find in the depths of the internet, these actually work and won't make you question your life choices. Intimate Rose approaches pelvic health with compassion, expertise, and reminds you that you are not alone. Because if your pelvic floor is acting up, trust me, you are in excellent company. Visit intimaterose.com and use code VOCAL, VOCAL, for a special discount. Your pelvic health matters, and with Intimate Rose, you can feel like your best self.
So I guess the first question would be, when we're talking about different, exploring that pleasure outside the narrow framework, getting outside of that, there is all kinds of things, different types of stimulation, different locations, non-penetrative orgasms. Let's go there.
Mm-hmm.
Talk a little bit about just the anatomy of orgasms in the genders, and let's just and talk a little bit about biology first before we then can get past that, I think.
Yeah. Like the thing with this is that I really hate to pigeonhole orgasm as like like one version of a physiological response, that this is what
Mhm.
happens in your body during orgasm, because there's so many different versions and people report
Totally.
so many different
Mhm.
experiences and things, and I don't want to in any way negate like the big rush of feeling someone gets from having their like earlobe sucked on, right? And say
Mhm.
that's not orgasm because it didn't happen through this pathway, right? Like it's absolutely orgasm.
That
Your
is, yeah,
skin can give you
absolutely.
an orgasm, nipples can give you an orgasm, the inside of
Mhm.
your elbow, like any of those things, all of that is absolutely legit, right? And that
Yes.
can be what you want. You can want that over a genital orgasm, and that
Mhm.
is just fine, right? And then when we get to like genital orgasms, like it can still be, like some it's like, well, is it a prostate orgasm or is it an anal orgasm, or is it a like G spot, or is it an A spot orgasm, or is
Mhm.
it a cervical orgasm, or is it just a clitoral, like I don't know. I'm kind of in like who cares boat with all of it, you
Well,
know?
some people may never have even heard what you just said.
Right?
Like, they're like, "Wait, what?
Like, what
I
are
thought
all
there
these
was one
things?
type." But you just listed like 5 or 6 different
I
ones, and
know.
then you blew our mind because you said non-penetrative orgasm, and now I just need to go sit down somewhere. So, I think a lot of
Yeah.
listeners will never even have heard that, the
Yeah.
different types, and that's probably where we should, like,
So
dance
we
in
can
that little arena for a second and go, "There are different types. There's a lot of different types, and you can get them a lot of different ways."
There are. And the most important part for any of these is that, like, I just want to, like, really say for your audience that none of these things are standalone ways of achieving an orgasm without having your mind and body warmed up and everything being aroused and your body wanting it, right? Like,
Mm-hmm.
and this is within the realm of consensual sexuality. I just want to say that there are some biological triggers that can happen when things feel complicated and non-consensual that can also happen, but I'm not talking about those in this part of the conversation. So I just want to
Yeah.
clarify that. Um, so, but so, clitoral orgasms are, for people who have clitorises, are the most common ways that we have orgasms. Okay. The clitoris, we've got like the if you pull back the top of your vulva, I don't even have my vulva
I know, and I'm in
in
the
the
wrong
room right now. It's
location.
in the
I could
other
pull
house. I
mine
know.
out too. I don't
Um,
have it.
but there's the head of the clitoris is the part like that's kind of like at the little apex of the labia of your folds as they come down. It's kind of like that top center part. But the clitoris goes down further and deeper on each side of the vulva and like around the vagina. So
She has
when
legs.
she has legs, right? And so when it gets, and it's erectile tissue. So
Mm-hmm.
whenever you're getting aroused, all of the things for someone with a vulva, all of the things that are happening are very similar to what the arousal is for someone who has a penis, right? We're getting an engorgement of our tissue. What that looks like for someone with a vulva is that the tissue is going to become more pink and it's going to become more poofy, and the vulva is going to kind of like bloom open a little bit more. And that's because that clitoris, that erectile tissue, is kind of like poofing things up more. And then the wetness that you get, that can happen very differently for everyone. A lack of wetness does not mean that you're not aroused.
Mm-hmm.
But that wetness is also part of that physiology of extra blood flow coming to the area, and then that extra blood flow causes kind of like a sweating through the vaginal walls, and then that wetness comes down into the vagina. Sometimes it can stay up really high, and especially like with what position you're in. If you're on your back, it might be that you're lubricated, but it's not coming out to the vulva, right? So you can work with that in any way. Always having extra lube. Sometimes you can like get really wet at the beginning and then it kind of like fades away, but you're still super into it. So using wetness as a source of like measurement of how turned on you are is not generally a great idea. And I also want to throw out, neither is erection, right? And
Mm-hmm.
this is the thing that I think screws us up a lot, is because like we use erection as this idea of like our sexual self-worth, both for the person who has the erection and also for the person who is judging their attractiveness by whether or not someone has an erection when you're sexual, right? So if you lose an erection during sex, that can feel to like, so if it's in a hetero relationship, like if a man loses an erection, that can kind of like kill it, not because the erection, like not because he's not turned on anymore, but because all of a sudden it shifts the dynamic, and there's like this thing that can make like women feel like, oh, he's not into me or he's not into this, when like that's not necessarily the case whatsoever. And so allowing ourselves to have like all sorts of different physiological responses and like talk to each other about, hey, is this working for you? Are you still turned on? You want to keep going? Does this feel good? And being able to work with that is really important. So even when talking about the physiology of like arousal and what means turned on, like you still have a brain and you still have to check in about how those things are working. You might also be like super turned on and have like, or your body's like super aroused, everything's wet, and then all of a sudden you just feel like something feels weird and I don't want to do this anymore. Great. Then you say that and you can not have sex. You don't have to have sex because you are aroused. You don't have to not have sex because one of your signs of arousal is fading away.
Mm-hmm.
Right. So, yeah, does that make sense? Do I need to clarify any points there?
Yeah, I think that, we started off talking about um, difference, gender differences in orgasms. I love that you went into the anatomy of the clitoris, because I mean, it's not been that long since it was actually correctly mapped,
Mm-hmm.
which is another mic drop moment. Because
Right.
I think people assume that, oh, we've always known what the anatomy is of females, and no, we haven't.
Well, except that we did like a long, long time ago. Like, and then it just kind of got erased, right? And now we've had to like relearn a whole lot of it. So
Yeah,
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 it's frustrating.
yeah. It's horrible. It's horrible. Um, well, let's talk about male anatomy for just a second.
Mhm.
With well, we talked about most of them being like clitoris based orgasms, but
Mhm.
we didn't really go into what the other types may be, and then talk about
Yeah.
um, penis owner orgasms.
Yeah. So, if as far as talking about different like physiological types of orgasms, right?
Yeah, I think it's how people, because people might
Yeah.
feel them differently, like time to time, and go, what is that? That one happened somewhere else, and then this one was somewhere different, or
Yeah.
intensity, duration, etc.
So, yeah, so there's the clitoral orgasm, which is usually achieved with like direct clitoral stimulation, and usually like clitoral, like it's the head of the clitoris, which is what we think of for like clitoral stimulation. But internally, like internal in the vagina, you can the when you are aroused at the front wall of the vagina, there is more erectile tissue around the urethra. That is the periurethral gland and what is usually referred to as the G spot. And the G spot can be like maybe the back of the clitoris, the periurethral gland, some different pieces, but there's definitely like a place that is like a, ooh, yeah, that spot, at the front of the vagina for most people, right? Um, if you're not turned on, you're not going to find it because it has to really like already be kind of like engaged and involved. And maybe you've had the experience to where it's like you're having sex and everything feels pretty good. And then you start getting a little more turned on. Then all of a sudden it's like, wow, what is that spot? That can be that sensation of kind of that like G spot sensation. But you can also kind of have a spot toward the back of the vagina that can feel really comfortable. And also, you can, the cervix, like you can have a cervical stimulation if, for people who still have a cervix, where that can be a very different sort of orgasm. The clitoral vagina or the clitoral orgasm and the like G spot and like vaginal orgasm, are generally going to come from the pudendal nerve. And then the cervical orgasm is going to be a vagal nerve response. And so that's really kind of cool. Like, and so
It
if for
is.
people, and we learned that because the vagus nerve is separate from the spinal column.
Mm-hmm.
So people who have had spinal cord
Spinal cord
injuries
injuries.
were still
Yeah.
reporting having orgasms, and it didn't make
Yeah.
any sense. How could they have orgasms? And it was because of the vagal stimulation that still happens in the internal organs of which the cervix is part of, right?
Yeah. Yeah. I remember
So,
when I first read that paper, I was like, I think I did fist pumps. I
right?
was
I
like, oh
know.
my God, this is amazing. Yeah.
Right. It's so super cool. And some people might really hate it when things hit their cervix on the inside, right?
Yeah. And for people who are no longer cervix owners, it's okay. There are other ways to get
Right.
there.
So many different ways.
Yeah.
And then like in the thing, like anally too. So we've got
Mhm.
around the anus, like even just externally around the anus, like it's all the same innervation as the clitoris and around the vagina and the vulva. And so all of that, like even just externally can feel really, really good. And I say that because sometimes people feel bad about realizing that things around their anus feel good or having a finger inside their anus that it feels good, and it's for people, it's the same thing that like for the penis and the scrotum and the like, it's the same nerves, right? It all feels good because it feels good.
I'm glad we're getting that out in the open right now.
Right.
Exactly.
So it's okay. It's okay for those things to feel good. Also, and I just want to say, like with anally, the wall between the vagina and the anus is not particularly thick. When we look at the pictures of the side, it looks like, it looks like the clitoris and the urethra are pretty far away from like the anus and the rectum, because it looks like the vagina takes up space. But the vagina doesn't take up space if nothing's in it, right?
Mm-hmm.
So
Mm-hmm.
you can also stimulate the G spot and all of those delightful places in the like, that you can in the vagina, with stimulation through your anus. So like all of that's still in play. Like they're not like magical different spots. It's just like, I think my biggest tip is like find the spot that's really good and keep doing the thing that feels good on it, right? And see where you
Yeah.
get, you know.
Yeah. Yeah. Exactly. How
um
about for penis owners? We
So
gotta,
for penis owners,
yeah.
like that's going to be similar. Like, usually penis owners are going to know like what feels good on their penis. And that's also a thing, like, for anyone who's partnered with anyone with any sort of genitals, like talk to each other about what you like done with your genitals. And if you feel comfortable with like showing someone how you like to have your genitals touched, great. Maybe it feels okay to like direct their hand on it. And if you're someone who is like, oh well, I don't want to like feel like I don't know what to do, like you are not the expert on anyone else's body but your own. So if someone is willing to like teach you what feels good on their body, by all means take every lesson that they will give you, right? Because then you can take that and run with it, and it can be really fun. But
Yeah.
so same thing with like we were talking about, that like with the anal stimulation around the outside can feel really fantastic. People with penises have a prostate, which will feel kind of like a walnut size, like a more solid section toward, like in the direction of the penis, that's not super far in. Like, if you're using one finger, it's like you don't have to go real deep to find kind of where that is, and stimulating that and just kind of like rubbing, tickling it, sometimes a vibrator or different toys, things like that. Those can feel really great. And you can have an orgasm from prostate stimulation. You can also have orgasms from external stimulation,
Mm-hmm.
external around the anus, external, you know, around the vulva, like with the labia. You can do all sorts of fun different things with, I'm going back and forth between, because I don't really draw a lot of lines between genitals, because some women have penises and some men have vulvas, and like we're just kind of all over the place. And
Yep.
it all
Yep.
comes from the same place, and
Yeah. We
we
just
do have
talk about
intersect.
that basic anatomy and then just apply it and however fashion it
Right.
applies to
So
you.
so it's like you just find the things that feel good and do them, and
Yeah.
and don't be afraid to play with things in a way that seems like strange. Like maybe like tug on your labia a little bit. Like maybe like roll that skin on, on the scrotum, or like tug and play with it and massage it in different ways. And like it doesn't have to be like one way of engaging, right? Which is, what we always think like, well, what is the right way? What's Cosmo say is the top 10 ways to do this thing, right? Like,
Yeah.
like play and be curious, and, and try different things and see what sticks, like see what are the things that are really good. Because when just the act of doing that makes your brain have to actually assess like what feels good in my body, right?
And
And go
that
from
is,
there.
yeah, that is so spot on, where I was hoping that we would kind of, go in that direction. But because by talking about anatomy and physiology and kind of the mechanics and the tissue of what happens with orgasm, you begin to realize there's the countless ways to actually get to the same place without it having to be penetrative. You don't have to have a particular sexuality and I think that for men too, because they will not often go to pelvic PT or OT when
Mm-hmm.
they need it, thinking, "Oh, that's not for me." Well, yes, absolutely, it is for you. Or, "Oh no, I'm a hetero male. We can't do anal play or whatever." And actually, no, you might find that you learn a whole lot from trying that, and it does push back those boundaries. It does give people permission to go. It's all the same tissue and the same nerves, and we have to figure out how we want to get to from point B from point A, and then set aside all of these kind of cultural and social narrow ideas of sexuality.
Absolutely. And like once you kind of like can crack that facade all of a sudden it's like, oh my gosh, there's so many things,
So freeing.
it's so freeing.
Yeah.
And so that can be lovely.
Pleasure is
And
just around the corner. We just
right,
got to figure out which corner.
right. And like, and pleasure can be yours if you want it to be, right.
That's right.
And
Without a
and
partner.
without a partner. Yeah. I mean, and some of it's like just fun, silly things like that I like to have, like, go into your kitchen and like pick 3 kitchen utensils that you would like your partner to use on your body in ways that you tell them how to, right? And like you can have this whole big hilarious things, and then maybe then you swap, right? So you both do that, and then like, and then it's like, okay, now you go pick 3 things that you want to use on me, and I'm going to let you know how that feels. Like, so all of these things where it's like having some control over what's done to you versus receiving what someone else wants to do with you, and like, and playing with different sensations. I mean, some of those can be super surprising. It's like, I really didn't think I would like a fork dragged across my back, and now I want that every single time,
Yeah.
you know? So
Yeah.
yeah,
We
so it
also
can be fun.
then don't get hemmed in by achieving whatever that satisfaction is for you in the same way every time, because just like we can't do the same workout for fitness, like you can't just go run 2 miles and do the same plank
Right.
and whatever, if your body accommodates to that over
Mhm.
time, and you have to have different input for exercise, different input, for sex, um, instead of just the same
Yeah.
thing all the time.
And also, there's like, for people who have a hard time having an orgasm, or maybe not ever had an orgasm before, like, I do not think it can be understated that orgasms are so often like when you're looking at the stars and someone says like, hey, there's Pleiades, which is this little cluster of 7 stars. But I swear to God, goodness, as soon as you look at it, it goes away. Right? You have to look beside it to then see it, right? And
Yeah.
so, like, making orgasm an intentional goal is usually the way that you're not gonna get to orgasm. So so
Oh,
instead, really making sure that you're feeling your body and feeling what you enjoy and being playful and being connected, is so often a better way to get there. And then also, like, if we have an idea of like, oh, well, orgasm should feel like this, like it should feel like this big explosive fireworks thing every time. Like
oh, yeah.
it doesn't, right?
Yeah.
Sometimes like you might have orgasms that feel like that. You might have orgasms that feel like they take you up to an edge and then they just kind of keep you on this crazy little roller coaster that feels almost torturous because you just can't get off of it, right? You know, like and they can be subtle. They can feel like they're kind of coming up and then they just kind of crest like a gentle wave and back. Like there's so many different ones. So, like, that being said, feel all of the feelings that you're feeling and appreciate and enjoy those, right?
Yeah.
So don't judge them all against this, giant bang of an orgasm that you think it's going to be. Like, appreciate all of those like intense, wonderful, lovely, delightful, like, put different words on them, feelings that you have, because like those very well might also be orgasmic and kind of have their own version of a crest and a fall.
Yeah. That reminds me, I mean, I lived at the beach for like a decade, 2 decades. And so what it reminds me of is going out and kind of like body surfing, and every wave is different, and some just drag you on the bottom, but you still come up exhilarated. And then some are very gentle, and then some just like smack you down on the shore. And all of it's fun. Body surfing in all of its different ways is fun, but that's what it kind of reminds me of. If you're just willing to like ride that wave, you don't know
Yeah.
how it's going to feel and where it's going to take you, but it'll be awesome. It can be awesome,
Yeah.
each
Just
time.
don't judge it against an expectation.
Oh, yeah, what you had last time.
Right.
Oh, that's a killer. Yeah.
Sometimes
So
they can
how
sneak up on you, right? Like those waves too. Like all of a sudden there's like
Oh,
this
oh,
huge wave.
yeah.
You're like
Smack you right in the
cruising
back of the
along.
head.
You're like cruising along sexually and everything's like, yeah, it's good, it's good. And then all of a sudden, oh my gosh,
Yeah.
like, where did that come from?
Yeah, I love it.
So
I love it. So that is a really good way to segue into, I mean, I've got so many other questions, and we might have to circle back and just do a part 2 on this, because there's just so many things that you can talk about, because we didn't even get to talk about the amazing expertise that you have in, just inclusivity, because we've been talking about kind of a
mhm.
genderless experience here, but there are also specific challenges, for populations that, the LGBTQIA community that we need to talk about. So,
Mhm.
what I want to ask is, well, first, would you be willing to come back for part two?
Sure thing.
And then the second thing is, how do people, so they probably at this point, you're listening and you're like, oh, I think I might have that issue, or I might need to push my boundaries on definitions a little bit, or I might need to learn some new things, or maybe I just need to talk about anatomy, or I am having pain down there. Any of those reasons could send you to a provider. And then you're
Mhm.
like, now what do I do? How do I ask if you're talking to a PCP? And just for the listener's sake here, I also want to emphasize that for all 50 states in the United States, at least, you might be outside the US, and I can't speak for that, but you do have direct access to physical therapy, pelvic physical therapy, depending on your insurance. But legally, you would have that direct access. But you still might be at your
Mhm.
PCP. You still might be at your urologist or your
Mhm.
GYN. How would you have them ask that provider to say, hey, where can I go for a pelvic floor, sexual counseling referral? What can I do?
Yeah, so the provider might not have any idea, right? Like,
Yeah. And they
it's
might
lovely to think
dismiss
that.
them and go, oh, that's normal, or it's age,
Right,
or it's stress, or just use more lube, or have a glass of wine, all the things that make us want to like just
right.
lose it. Yeah.
Yeah, because there's more to it than that.
Yeah.
Um, and so asect.org, AASECT.org has a directory where you can find people who are nationally certified. And so that's really helpful for and then also for pelvic physical therapy. If you go to pelvicglobal.com, there is a directory there, and those are all going to be pelvic health providers, but then they also are going to list if they do sexual health and kind of like what they do there. And it's a geo directory, so you can put in your zip code and then find who is close to you that way. And then you can ask about those practitioners you can certainly ask your doctor, be like, hey, I'm having some of these issues, and I've searched a little bit, and it seems like maybe this would be a helpful thing for me. Do you have anyone that you tend to refer to? I found a few names. Like, do you know anything about any of these people? Like, you can kind of ask it that way too, to where it's like, I've
Yeah.
done the work, I've seen the things. What do you think about this? Can we collaborate on this decision about, where I might want to go next? And I just say
Mm.
that to be like, if you're just going and hoping that the doctor is going to have the answers for you on what to do next with your sexual health, like, you might be disappointed. Like,
Yes,
but
maybe.
don't let
Mhm.
that stop you. Like,
Yeah.
don't let that be like the end of the road.
Yeah,
Yeah.
absolutely. And the other thing that I wanted to point out too, is if you do feel it dismissed or invalidated or kind of blown off, then you were. Don't guess yourself.
Mhm.
Trust yourself on that, and also realize that all of these providers out there typically will answer questions for you. Like, I know probably in your practice, in my practice, I will do a 10-minute free consult and say, this is a good fit, or
Mhm.
maybe the other person might be a best fit for you.
Yeah.
Many providers will talk to you directly in the therapy space. So that's even less fear and less risk, knowing that you can just reach out and ask those questions and go, is this a good fit? Can you help me?
Yeah. And so as a sexuality counselor, when I do that separate from pelvic PT, which I don't actually see patients for pelvic PT right now. So everything is like, it falls under more of a coaching mode, and I can do coaching across state lines. And so it's one of those things where often what happens, is that I'm just trying to help people understand the system, and like, here are the pieces of this that I can help you with. And these are the other practitioners that I think would be really important on your, as my colleague, Dr. Uchino Osai always says, on your sexy dream team,
I love it.
because the other thing is, sometimes when people go and they talk to a doctor, if that doctor's like, oh yes, I know all about this, you need to see a urogyne, you need to see a sex therapist, you need to get EMDR, and you need to go to a pelvic PT. And that's a lot, right?
Mhm. Mhm.
So sometimes
Yes.
there can be like this, like so much stuff, and people are like, okay, I cannot afford to do all of this at the same
Right.
time, and I don't have time
Yeah.
to do all of this. One of the things that sometimes I kind of just like help with is being able to help navigate like what's important and who's good and what might be effective. and like maybe what sort of like line, and let's see how we can figure this out in like the most frugal way possible, and like what are some free resources, and go from there, and pick some stuff out from there. So I'm so sorry about that.
Well, we are going to wind this down, and truly, if it's okay to come back and do a part 2, I would absolutely love to do that, because I only reached the halfway point in the questions that I had to ask you, and I really want to speak to marginalized communities and people who struggle to find care, or struggle to feel validated and get medically gaslit, or worse, when they're trying to seek out the right providers, and also people with pelvic pain, because we really didn't get to talk about that either. So if you would share with everyone where they can find you for coaching and counseling, and then we will carry on with the part 2.
Sounds good. Yeah, you can find me on my website is Heather Edwards Creations at .com. I was like, wait a second, what am I saying here? Yeah. My email is info@heatheredwardscreations.com. You can also find me on Instagram at Heather Edwards Creations, and also at Vino and Vulvas. You can also, if you want to learn more about Vino and Vulvas, vinoandvulvas.com will show you that. And I'll have shows starting again in 2026. So I'll have the dates. The dates might actually already be posted. So if you want to schedule your time around come visit Asheville and see a
Love
VMV
it.
show, yeah, you can do that.
I absolutely love it. Thank you so much, Heather, for joining me today, and I look forward to continuing the conversation.
Thank you so much.
Hi, friends. Dr. Ginger here. I hope you're enjoying the episode. If you want to help keep the Vocal Pelvic Floor running and support the important conversations we're having about pelvic and women's health, there are a couple of ways you can help. First, leaving us a 5-star review wherever you listen to podcasts really helps other people find the show and lets us know what you love. You can also make a donation through the link in our show notes. It goes directly toward covering production costs and making sure we can keep bringing you this content for free. And if you're a business interested in supporting the show while reaching our amazing community, we have advertising opportunities available too. Thank you for being a part of this journey with us. It really means so much.